Good morning, it's Dr. Garrett, and I am here in the great outdoors again today. And today I wanted to talk to you a little bit about our weight loss programs. So as you know, we offer a variety of different weight loss solutions to help you become the person that you're designed to be and to help your body become the machine that it was designed to be. Now, one of our weight loss solutions is the semaglutide, and that's the one that is the most popular right now. So let's talk a little bit about what semaglutide is and how our weight loss program works and why it works. So semaglutide is a medication that has been used for type 2 diabetes. Its generic name is semaglutide. There is a couple different brand names, Rybelsus, Ozempic, and Wegovy. They're all the same medication, it's just that the indications were a little bit different for each, so they got a new name. Now, what these medications are is they are GLP-1 receptor antagonists. GLP stands for glucagon-like peptide. Antagonist means it fights against. So what it does is when it gets into the body says, hey, we've got a little extra sugar in here, let's get rid of it. So these kind of block those receptors so that the body doesn't uptake the sugar. So how does excess sugar make fat? So when we have excess sugar and insulin circulating in our body, it signals to the body, let's store it because we can use this for energy for later. And so what it does is it stores it usually within the liver and within the muscles. However, when we start getting a lot of excess blood sugar and excess insulin circulating, then what happens? It is no longer stored in the muscles or the liver, it's turned into fat, and that's what causes that weight gain. So what this does is it's a once weekly injection, and it causes your body to stop trying to store that excess sugar as fat. So you lose weight with it, which is really nice. Now, how does it work with us? Now, as you know, semaglutide is one of those medications, like all medications, that's a chemical that we are putting into your body. It is not a natural chemical, it's an artificial chemical. So when any kind of artificial chemical, there's always a risk of adverse reactions. Some of these adverse reactions could be medullary thyroid cancer, pancreatitis, or even things like endocrine neoplasia syndromes, which is where you just start developing all kinds of different little cancers. So there are certain people that we would not use this medication for weight loss. And that would be people with a history or a family history of thyroid cancers, history of pancreatitis, high triglyceride levels, and also people who have just cancers or different weird benign things that just makes me feel uncomfortable with giving them this medication. So with that, we do check your blood. During our consultation, we bring you in and we ask you, what time do you eat? What does your rituals look like? What do your daily meals look like? What have you tried before? How many pounds do you want to lose? And then we develop a plan for you and we tell you how to reach these goals. Now, one of the big things that a lot of people ask me is, will I gain all of my weight back once I stop? The answer to that is, it's up to you. Now, how does this work? We are not giving you a quick fix. We are not giving you something to help you lose 25 pounds and then it's gone forever and you're good. We want to teach you habits to start establishing now so that you can lose the weight and keep it off permanently. So what kind of habits? Each week when you come in, we're going to be talking about food choices. We're going to be talking about sleep. We'll be talking about rest. We'll be talking about food combining. We'll be talking about organic versus inorganic, the dirty dozen versus the clean 15. We're also going to start establishing new habits to get you eating correctly. One of the side effects of the semaglutide is you don't want to eat, you don't feel hungry. So making sure that we put the right food choices in your body to fuel it is very important. So we're making sure that you're just not eating a cookie a day and losing weight. We're keeping your basal metabolic rate at a certain level so that your body will continue to function as a machine. And you will notice that when you come off of it, you won't gain that weight back. So it's really wonderful like that. Now, with the semaglutide, as I alluded to earlier, they are once weekly injections. We draw your blood, we look at your thyroid, we look at your vitamin levels, we look at your liver to make sure that everything looks well. As long as everything is doing okay, then what we do is we start you out kind of on the lower dose. Usually we're starting on a lower dose so that we can make sure that there are no side effects. We start you off low and then we build you up gradually. The first month, you're looking at $350 for the first month. The second month, $450. The third month, and thereafter is $550. After the third month, I'm redrawing your blood and checking those thyroid levels again, just to make sure that nothing is changing. If I notice that things are starting to change, then we take you off the medications. Now, how much weight can you lose? Usually that first week, it's just a pound or two. Some people can lose up to 5 pounds that week. Usually that's a little bit more water weight than anything, or inflammation weight. Now, between weeks 2 and 3 is where we start noticing some of that substantial weight loss. So this is where we're noticing anywhere from 5 to 10 pounds, depending on how much you weigh. Now, again, we want you to lose weight at a healthy rate. You should not be losing 20 pounds a week. If you weigh 150 pounds, you should not be losing 10 pounds a week. We want it to be a healthy weight loss. And so we're monitoring that as we go. In total, we have people that have lost over 50 pounds in the past 3 months, whose BMI was set pretty high, and they're feeling great, they're looking great. Their whole life has changed. So we're very happy with the Semaglutide. If you'd like to make an appointment, call the office. It's 812-290-2128. And again, the consultations are $25. We're going to be talking about a whole bunch of things during that consultation. And then if you want to get started, we draw your blood, we bring you back, and we'll get you started right away. If you have any questions, give us a call.